Now here is something most of us are not familiar with, but we should probably be. It's adult epilepsy.
Dr. Louann Carnahan is here, who is specialized in the condition, is here to shed some light on the issue. Doctor, thank you so much for joining us.
Hi, thank you for having me. It's a pleasure to be here.
Well, let's actually start out by kind of learning about you first.
Yeah.
Kind of tell me about your background and how you came to get into adult epilepsy.
Sure. Well, I'm from Missouri, and so I did medical school training in Kansas City at the DO school, and then I did my general neurology residency with the internal medicine internship year in Chicago at Loyola University Medical Center, and then I did my epilepsy fellowship training in Boston at Beth Israel Deaconess Medical Center. It was one of the hospitals of Harvard Medical School.
Wow,
Okay.
you've been to a lot of places.
Yeah, you sure have.
Definitely.
And I know today we're really focusing on adult epilepsy.
Yeah.
Now I kind of want to start by talking about seizures. And are seizures the same as epilepsy, or
Right, that's an
explain
excellent
that for us?
question. So seizures are when the brain has abnormal overfiring of electrical activity, sort of like this. And so anybody can potentially have a seizure, even the general population, even in someone who's not predisposed to epilepsy. In those situations, they can be provoked, sometimes due to certain medication withdrawals, alcohol withdrawals, low blood sugar levels, and so that can provoke a seizure in anybody. But in certain individuals who have what we call a predisposition to recurrent seizures, if someone has 2 or more recurrent seizures that are unprovoked by those situations similar to that, then we would say that that person has epilepsy.
So when we're talking about adult epilepsy, is this something that you develop as you become
Some
an adult?
people can, yeah. So sometimes someone can go through their whole life into adulthood before suddenly out of the blue developing a new onset seizure. And one of the most common causes of that is stroke or head injuries, or any sort of injury that causes brain tissue damage.
Okay, so then let's say we're starting to have the symptoms that you're saying, or frequent seizures like that. When is really the time that we should be going to the doctor for this?
Sure. So anytime you have any concerns about any episodes that might be seizure, you should always go to the hospital immediately, especially if it's new. And then at that time, they would do general testing in the hospital and would refer you to a neurologist at that point. And you can see a general neurologist. You don't necessarily have to see an epilepsy specialist per se. But in the situations where if you have seen a general neurologist and tried some seizure medicines but have been unable to have control over the seizures for 12 months, then at that point the National Association of Epilepsy Centers then has guidelines and recommends seeing an epilepsy specialist.
Okay, so whatever route we get to see someone and we've decided this is what we're dealing with, what are some of the treatments that we're looking at?
So the first line treatment is medications, because we always want to try non-invasive treatments first. And what's great about the field of epilepsy is that there's over 20 medications out there on the market that are different options and that we can pull out of our back pockets and have as tools to control seizures. Otherwise, and about 70% of the population, their seizures are easy to control or are well controlled with only maybe a few breakthrough seizures here and there if someone misses medications or is sick. But in about 30% of the population, some people are more refractory. Well, we call that being refractory, and the seizures are difficult to control and on many seizure medicines. So at that point, there are certain situations where if you are a candidate, you could potentially have epilepsy surgery if the seizures start from only one focus in the brain and then spread from there. And then there would be various workup, and at that point you would have assumed, you would have gone through many different seizure medicines, come to an epilepsy specialist like me. We would do further testing, which would include long-term EEG monitoring. Generally, we do that in a hospital setting. We would have someone come in, stay for 3 to 5 days, hooked up to different EEG electrodes, and then just monitoring for where the seizures come from. And if it verifies that the seizures are only starting in one place, then we could do further testing. And if the area of the brain where it starts is not eloquent, meaning it doesn't control special functions like speech and language or memory or motor function, then that person could potentially be a candidate for epilepsy surgery, which that is potentially curative. So once we go out and remove that area of the brain that is where the seizure starts, then a person could potentially go on and be seizure-free.
Wow. So I know we're talking about a lot of testing and medication and stuff, some done at the hospital, but some I imagine are done right at the Center for Neurosciences.
Right.
So tell us more about the center, what you provide there, and the kind of patients you like to see.
So the Center for Neurosciences is a multi-specialty group that involves neurologists like me, but also neurosurgeons. We have other specialties as well. There's a sleep medicine physician there, interventional pain management, and a neuro-oncologist and radiation oncology as well. And so we're all focused in this one center, and we sort of share in our patient populations. And then, of course, my specialty then, I see a lot of epilepsy patients, but I also see a lot of general neurology patients as well.
Great. Well, doctor, this has been really great to learn more about all of this, and I want to make sure that our viewers have a way to get in touch with you directly, so I'm going to let them know how they can do that. And I want to say thank you so much for joining us.
Thank you for having me. It was a pleasure being here.
And to learn more about epilepsy and general brain health, just call 795-7750 or log on to neurotucson.com.